Booking.com is the easiest way. From a day surrounded by noise to a stay surrounded by nature. That's nice. Go on, book it. It's easy. Booking.com. Booking.yeah.
When you think about Crocs, you think the classic clog. But did you know there's also a canvas clog, a vegan suede clog, a coastal-inspired style, a style with studs, straps, and lots of sass? Honestly, I could keep going with the surprises. You've got to see them for yourself because there is literally a style for every kind of girl. So do your thing and head to crocs.com or a store near you now.
Hey everyone, I'm here with my friend Dr. Raj.
Hello.
And we're here with the 5-minute care tip of the day. Today's topic is interstitial lung disease, or ILD. I go around saying ILD to folks when I go in with my mom because she has ILD as part of her scleroderma journey. And the doctors immediately look and go, whoa, he knows what he's talking about because I use ILD rather than lung disease or something. So, Dr. Raj, talk to us about ILD and including IPF, which I'm not quite sure I know what that is.
Sure. And so I'm going to try my hardest to make it super simple. So on the top level, when I think about lung disease, I put them into two broad categories: obstructive lung disease and restrictive lung disease. Obstruction is usually a disease of the airways itself, meaning that it's COPD or asthma. When we talk about restrictive lung disease, most of the time we're talking about the restriction being in the body of the lung, called the lung parenchyma, called the interstitium. So many people will have what's called a restrictive lung disease and interstitial lung disease. And I can think about it, if there's an alveoli, which is like a little balloon, and there's a blood vessel below it, that small space in the middle is kind of like the interstitium. So how do we make that diagnosis? You're going to get some breathing tests. You're definitely going to get a CT scan of the chest. And I'll say this to be a little too medical. Anytime I worry about an interstitial lung disease, I'm probably going to get a high resolution CT scan of the chest. And your doctor will know what that means. Now, the question becomes, why? And there are different ways to categorize all these interstitial lung diseases, and literally there are hundreds of them. But to keep it simple, they could be idiopathic, meaning I don't know. And if you don't know what it's from, they have different subtypes of what we call idiopathic. The most common type is idiopathic pulmonary fibrosis, where the lung starts becoming more and more fibrotic, where you can't even imagine it, you can't even move air. Now, other types, of course, and how do we get to this idiopathic? We have to rule everything else out. And how do we rule everything else out? What is your occupation? What medications are you taking? Do you have a rheumatological disease? So many rheumatological diseases like scleroderma, myositis, rheumatoid arthritis, they are highly associated with developing these pulmonary fibrosis. What separates them from idiopathic is because they're not idiopathic, we know what causes them, the underlying disease. So I would say the most important thing is that whether you have a underlying rheumatological disease, remember, that's not just a disease of the joints or the muscle or the skin. It can affect almost every organ in the body. You know, talk to your lung doctor, talk to your primary doctor if you're having shortness of breath. If you have pulmonary fibrosis, you know, I'm going to tell you right now that there are newer medications are coming out there. There are medications called antifibrotic, like they sound, that will help kind of slow the decline in the fibrosis. So there's definitely options out there that we never had before. So I'm so glad we talked about this. ILD has many different subtypes. If you have idiopathic pulmonary fibrosis, yes, you know, see your doctor, establish care. if you have an underlying lung disease like a rheumatological disease, yes, you know what? We're probably going to be in a multidisciplinary meeting where everyone's going to contribute to treat the underlying disease and the pulmonary fibrosis. I hope this makes sense to everyone.
This was great. Really, a lot of detail there. It definitely helps understand what ILD and all the surrounding issues we need to consider. So, Dr. Raj, thanks again, and we'll look forward to seeing you next time.
You're welcome.